Good evening. The assignment for this week is to evaluate the video that they stated about evaluating assignments, looking them up through Google. There are many reasons you should not go to the internet for all of your research assignments, valuable information. Just like the video said in pertaining to looking up research, Google and many websites on the internet don't give you all of the information. That's why a lot of professors, etc., schools will tell you to go to their library and use the resources that they have provided, because you get more, like in the video, you get more detailed accredited information. So using Google is good for some things. I know that we have a lot of patients that will say, well, I looked this up on the internet, I have this going on, I think it's this, or they aren't 100% sure. But I know a lot of people that do like to go onto like WebMD and places like that to get information to try and self-diagnose themselves before coming into our clinic. And a lot of times you can't do that because you don't know truly what is really going on. That's why they have medical clinics and doctors and nurses and the healthcare field and healthcare staff. There are a lot of people that I know they have this new source out where most insurances will provide a doctor on site that will do like online diagnoses and do like a webcam and talk to you and treat you, or give you your symptoms. But I feel like that's still not very professional, because you're not getting that one-on-one service. You're not getting that one-on-one with a doctor or a nurse to be able to look at you and say, hey, this is what's going on, this is your symptoms, this is how we should treat it properly. Or if you have someone with like congestive heart failure, or many different illnesses, diabetes. We have a lot of elderly patients that get your UTIs very often. And so it's one of those things that until you can actually do like a urinalysis or a dip, you can't really treat what they have going on online. And a lot of times I know that we like to see our patients in clinic, because even sending them over a prescription for something, we can't necessarily treat that properly because we haven't seen that patient. And again, a lot of patients will go online and, just type in their symptoms or type in any kind of information that they're looking for, possibly, but not have the correct diagnosis and not be able to provide the correct treatment. So therefore, they're still coming up with the same scenarios. They're still having the same issues, the same problems. So using the internet is good for a lot of things. It's good for a lot of knowledge and things like that and your research, but it doesn't give you 100% accuracy on a lot of things that you could be going on. And there's such a wide range of it. So it's one of those things that you definitely have to be cautious and careful about. So have a good night, everyone. Good luck with this week's discussion assignment. Have a good day.